So, the first on our agenda, we're going to bring Sheriff Dennis Lemma. He serves as the sheriff of Seminole County in Florida. He took office in January of 2017 as the 10th sheriff in the county's history. As the county's chief law enforcement officer, he leads a workforce of more than 1,400 employees and manages a $140 million budget. In January of 2019, the Attorney General Ashley Moody named Sheriff Lemma chair of her Transition Advisory Committee Working Group on Opioid Abuse. As chair, he will work closely with the Attorney General and others to gather information related to the best practices to stop the influx of deadly opioids, treat addiction, raise awareness, and reduce the death tolls of this crisis, claiming 17 lives a day in Florida. In July of 2019, the First Lady, Casey DeSantis, announced the formation of a drug abuse prevention panel with Seminole County Sheriff Lima, who serves as its chair. The focus of the panel will be to discuss and determine best practices and innovative solutions to combat drug abuse throughout the state, specifically as it pertains to Florida's youth. He's an honorable discharge in the U.S. Marines. He has a master's degree in administrative leadership. He's a graduate of the FBI National Academy in Quantico. He also attended the Florida Department of Law Enforcement Chief Executive Institute in Tallahassee, Florida. But he's a dad of 2 young sons and a devoted husband. So without further ado, Sheriff.
Well, thank you so much for that wonderful introduction. Good morning, everyone. Michigan is a wonderful state. I wish I could be there in person right now because we quite literally have a hurricane hitting us here in Central Florida right now. But we're going to move on. Everyone seems to be okay. And I think that the topic right now that we're talking about this morning is probably one of the most significant things prior to COVID-19, and I suspect after COVID-19. We know this pandemic has really focused everyone's attention on the immediate health needs of our citizens. But we had a big problem brewing ahead of this thing. We know that COVID-19 has brought unprecedented challenges when it comes to substance abuse and mental health. And you can only think for a moment, if you were dependent on some type of substance prior to COVID-19, the loss of employment, moratoriums running out on housing, all of these stressors that are being added to it has only increased the likelihood that those people who are dependent are moving back in that direction. The problem is many of these individuals are unreported. So we're going to talk about some touch points here and specifically what law enforcement's role should be in this thing and how we can come together and partner as a community. I think first we need to identify that this is not a situation. Opioid use disorder is not a situation of trying to make a bad person good, but rather a sick person well. And we have to treat this as a clinical problem, just like we treat any other medical challenges that occur in our community. And I think that one of the biggest challenges that we have collectively is the stereotypes that are associated with dependency, particularly substance abuse, opioid use disorder, because there's a lot of people who quite literally don't understand it. Many of you have heard the presentation that I've made in the past about how we got here with big pharma and doctors overprescribing and people really largely thinking that they were doing what was in the best interest of the patient. But we've identified what the problem was. The thing that we overlooked as a country is as we monitor the amount of people who can be prescribed opioids and the individuals who are overprescribing opioids, we did not recognize the amount of people who had already built up that dependency and have turned towards street level heroin, buying what they feel is Oxycontin online that is simply laced with fentanyl or other types of synthetic substances, which led to an unprecedented amount of deaths. I also think that we have to recognize that if you are on the journey towards recovery, you are almost 100% likely to have a co-occurring disorder when it comes to mental health. And I think that we have two different spaces. Each space is trying to treat substance abuse, another space is trying to treat mental health. but that all has to be combined and work together. As we see for the first time in nearly 100 years, the negative effects on life expectancy across the United States, and that was prior to COVID-19. You can only, again, imagine the problem that we're going to face here in the need for social services as we come out of this thing. But I think that we have a pretty good strategy moving forward that I'd like to kind of share with you. I think that the first thing that we have to recognize is when we deal with statistical data, we're really dealing with four general touch points. And the general touch points where we can actually track people are individuals who voluntarily or are moved into a treatment environment for whatever reason. That's one touch point. Another touch point is the people who are involved with the criminal justice system, where their only violation is a direct correlation to their substance use disorder. I think that's the second. I think the third is hospitalizations, particularly overdose situations that first responders are called to. And if they are in a more progressive district, they're revived with Naloxone, brought back and then hospitalized. And then unfortunately, the fourth general touch point where we look at statistical data, not timely enough, in my opinion, is mortality rates. But those four particular areas are the extreme cases of somebody who is suffering substance use disorder. And those are individuals who are using every single day, but they may only overdose one time a year or twice a year. So I think that anytime we look at data, which is off the charts, I think that we have to keep in perspective that these are only the most severe violations of people who are dependent in need. I'll take our county here alone. Seminole County is one of the most affluent counties in the state of Florida, 309 square miles with 500,000 people living within the area. Great school system and all that, but we've had a 58% increase in our overdoses, opioid-related overdoses since January 1st, 58%. We've got a 60% increase in the deployment of Naloxone by first responders out on the streets, and about a 20% increase in overdose deaths. And to put those in raw numbers, there are 81 deaths in Seminole County that are opioid related. There's never been a time in our history that this many people has died from anything ever. And I tell you, those numbers, if we're not careful, are going to continue to increase. So what we've done here is we made some general observations. One, the number one predictor on whether or not somebody will overdose and die is whether or not they've overdosed and survived. And up until this point, jurisdictions across the country have done very little to help this population. There's a narrative of expanded Medicare, Medicaid across the country. Some places have it, some places don't, but nobody should be turned away from these services, because we know that if you overdose, you're revived with an opioid antagonist, particularly Narcan, and then you are hospitalized. If you are released back into the same environment that you just left, you are 800 times more likely to overdose and die within the next 12 months than if you received services. So what we said was we had to cater to that at-risk individual. You think about it right now, if you fell out in your house or in your office right now, the people who are around you would render aid to the best of their ability. They would render aid, they would try to ensure that you survived, and they would call 911. Paramedics would arrive, they would transport you to a hospital. And at the hospital, one of three things would occur. One, they would treat you there, stabilize you, and let you go. Two, you were more severe and they could not treat you there, so they had to move you to a more advanced floor inside the hospital. Or three, they evaluated you and gave you a referral to follow up with some specialist to get some tests done or other work done. That's what happens when you have any type of medical emergency that you can imagine, except for overdose. Many jurisdictions, if not the majority of jurisdictions across this country, would have step one occur. The people around you when you fell out would render aid. Step two would occur. The ambulance and paramedics would arrive and transport you to a hospital. But step three, when the hospital workers would find out that you overdosed and died and were revived by Narcan, once you were stabilized, they simply release you back into the exact same environment that you overdosed in the first place. Again, increasing that likelihood of overdosing and dying within 12 months by 800%. So what we did was we said, we need navigators that are going to go to the hospital immediately on every single overdose situation, not from a criminal justice perspective, but to lend services to that individual, and probably more importantly, and many times overlooked, that individual's family on navigating a course and a path and a plan back to recovery. Behind every person who is navigating a course back towards stability, there are 5 to 10 people that cry themselves to sleep in their pillow at night, wondering, what can I do? I wasn't aware of this. The doctor simply prescribed these drugs. I knew that my loved one was taking something, but I had no idea it evolved into an addiction. So navigators for the individual, but as importantly, their family members. It's always interesting that many programs across the country will start issuing Naloxone to the person who is suffering substance abuse disorder. But the likelihood of them actually carrying that reliably or administering is almost zero. Because if you overdose and die, it usually occurs just like that. It's usually a hot dose of fentanyl, carfentanil, and the person does not have the ability to administer to themselves. And quite literally, they're not acting in their right frame of mind. The amygdala part of the brain is in control. The frontal cortex of the brain, where we have rational thought and rational decisions, is not taking an effect. So it is probably more important to make sure loved ones and those that are around the family members or friends on this journey are equipped with Naloxone. Actually, everybody should have Narcan. I mean, we talk about Narcan like it's a wonder drug. Narcan has been around for 60 years. And it's just recently we're trying to legislate and make sure that the drugs get into the hands of all of those people that could have access to it. I actually had to change the law here in the state of Florida because it allowed law enforcement officers and correctional officers to administer Narcan with a hold harmless protection, but not every other member of a law enforcement agency. Everybody should have global access to Narcan. So this team that we put together is the Seminole Collaborative Opioid Response Effort. Social workers, law enforcement officers, hospital workers come together. We partner to provide that critical service anytime that somebody's hospitalized. And then there's follow through with that, not only for them and their family members as well. There's another thing that we see people that have never, ever, ever been involved with the criminal justice system at all. But because of their dependency, they have now committed ancillary type of crimes. It is, we feel that crime is a symptom of another problem. In order to make communities safe and protect people, you have to address the underlying conditions that are present that lead people down the path to commit crime in the first place. This whole criminal justice system of arresting people, taking them to jail, and then scratching our heads on the level of recidivism that we see the same people frequent flyers going back. It's only because they're not fixed. There's a reason why in the incarceration environment, we call those places correctional facilities, because the actions within those facilities should actually try to correct behavior. But to give you an example, we partnered here with our local healthcare provider, Advent Health, and we wanted to offer a diversion program where those individuals were charged with a crime, and their only violation was a direct correlation to their dependency on a drug. And because of that, we can keep people's records clean. We can get them the help that they need. And I think we all agree that the greatest help typically does not come within correctional facilities. It comes from outside facilities, outside healthcare facilities. So we created this new center, Hope and Healing. There was a building right across from our correctional facility. It was normally used one time as a work release program. It was later our county probation office. I moved county probation officers to work in a more remote environment, as we're doing now. We're having this conference now. And then we gave that building to the local hospital. That building is able to have 40 plus residential programs. They administer all three forms of medical assisted treatment. Whether it's Vivitrol, the more traditional methadone that a lot of people are aware of, or buprenorphine, all three, because we feel that should be a decision between a medical doctor and a patient. And we know that some people are genetically prone to have a greater effect on one substance, but they do that there, but they do a lot more. If there's uninsured and underinsured, nobody is turned away at this location. If there are a person who has insurance, we help them fight and argue and negotiate with their insurance companies to make sure that the services that they need are covered. And again, for the most severe cases, we have a residential program that we put in there until we can find permanent long-term placement, or we have the ability to provide assisted outpatient treatment at their home in a more catered type of environment. These are people that would normally be involved with the criminal justice system, but are being saved from that exposure. The third step we put in place is for those people who are incarcerated, those people who have committed a crime and the victim of the crime just simply wants to prosecute. We've created and completely remodernized our correctional facility to have various programs. One of the programs is called the ACT program, Accepting Change Through Treatment. And we're one of the only local correctional facilities that performs all three forms of MAT within our facility. Again, methadone, buprenorphine, and Vivitrol. We're all using all three. And again, that's a patient-doctor decision. But what's sad is because of the X waiver, many physicians across the country simply do not have authorization to administer in the drugs that help break the addiction. And I think by now, the people who I'm talking to, the people who are on this call right now, know that the gold standard of treatment is MAT. And we're providing that, but we're also providing that with combined cognitive behavioral therapy. We have therapy dogs that we actually have abandoned dogs in the county. We partner with animal control, and we take those dogs to be trained by our returning citizens inside of our correctional facility. They care for the dog, they care for the animals. And then when you walk into the cell, it takes on a more house and home type of environment. There's bed sheets, there's little personalizations around the correctional facility. And then at the second tier, there's photographs of every participant when they were healthy and well, when they were with their family members, when they were with their children. And I'm telling you, the most remarkable thing happened when we started doing this. The staff members, the correctional officers, the detention deputies started to get that release of dopamine. They said, you know what, I feel really, really good about myself. I feel when I'm actually making progress in changing somebody's life, I feel like I'm making a difference. And I think that all of you that are on this, are in this conference today, were attracted to social work and this business because the greatest responsibility of any civilized society is to protect and preserve human life. And that is what we're doing. Actually, these programs have been so successful in our correctional facility. In my nearly 30-year career, I've never seen a time where people who are incarcerated are actually petitioning the judges to have their sentences extended because for the first time in a long time, they're getting clean. It says something when family members are relieved that their loved one is arrested and incarcerated because they know that they'll be safe. And again, it doesn't end there at the correctional facility. There has to be a warm handoff between the services and the MAT regiment that we start on the inside and those service providers that will continue that service on the outside, which brings me to the next topic of something that I've had to work very hard is to convince the faith-based community. I love our faith-based partners. They do a lot of work with rehabilitation and reentry programs. But for many, they would not accept any returning citizen that has started an MAT regiment, particularly on the methadone and the buprenorphine. because of his presence of opioids. They felt like simply that the way forward was to simply just abstain. And I think that the science shows us that abstaining simply does not work for everybody. Prayer is a big part of it. Faith is a big part of it. Cognitive behavioral therapy is a big part of it. But what we know and what the science tells us, if you do nothing more than take the medicine, you are very, very likely to have a successful path. You may be able to weed off the medicine. Some do, and then some don't. Some are on a medical regimen for the rest of their lives. So I think that, we have to understand and recognize the science when it comes to these things. So these programs are very, very successful. Again, one of the only local facilities that performs all three forms of MAT. And I think more than anything, me standing as a law enforcement officer, actually a Republican sheriff, we vote in partisan elections as sheriffs, but being in the role, I think that the voice that we have, when I first started talking about this, it was like an empty room and you would hear crickets. But the more I talked about this being a medical condition, not a situation of making a bad people good, but rather sick people well, when people would ask me, what do you say to people that say, well, you're just treating a drug with a drug? I said, we're treating a drug with medicine is what we're doing. I think more people felt more comfortable kind of saying, okay, it's okay for us to get behind this thing. And I tell you, it feels incredibly good to be involved with a movement where both sides of the aisle can get behind and support. These programs were so successful here. Executives from Walmart came to my office maybe 4 months ago and gave me a check for $500,000 and say, here's $500,000 to support your programs. We believe in what you're doing. You're actually changing lives. You're having empirical evidence suggest how successful you are. And we're likely to be back next year with another check for $250,000 to sustain that. The local hospital chain goes in $1.5 million a year of in-kind contributions and completely staffs that Hope and Healing Center that I talked about earlier. And there was only one condition that I had for them is the outside of the building does not say clinic, does not have a 5-point sheriff's office star, doesn't say Seminole County facility, because when patients walk into that facility, regardless of their dependencies on opioids or nicotine or whatever it is, I want to make sure that they feel like they're walking into a state-of-the-art, high-class facility that they would receive with the best insurance coverage or receive at any one of our local hospitals. That was important, not to have this stereotype of this black cloud behind that. The next thing, as I wrap up here, we came together and started this new initiative. Two new things I want to talk about briefly. It's new. One is Victoria's Voice, and the David and Jackie Siegel Foundation. David is the CEO of Westgate Resorts. They lost their daughter to an opioid-related overdose a little over 5 years ago. They've started a process, an educational process in schools. It's called Victoria's Voice. It's being piloted out in Las Vegas School District. We're piloting it here in Seminole County. That is very helpful because they completely fund it themselves. Great education and awareness. And then I'm also a part of this group called Project Opioid that is now expanding to the state of Florida. It is run by Andre Bailey, who is the CEO of Project Opioid. And it's co-chaired by myself and Kim Lopdrop, who's the CEO of Red Lobster. The business community, the faith community, and government coming together to collaborate, to develop strategies to work on addressing this. I got to tell you, there are a lot of businesses out there that after 30 minutes of hearing what we know about this epidemic, they say, you've convinced me, tell me what I can do to help. I'm in there. And they're more than generous when it comes to writing checks and supporting our efforts. But again, Project Opioid, if you contact me, I can give you a piece of that information. It is very, very successful as we move forward. And last and certainly not least, I think that right now our focus has to be the unintended collateral consequences of COVID-19. We've seen reports of domestic violence balance out or decrease during COVID-19. We've seen reports of child abuse decrease during COVID-19. But unfortunately and alarmingly, it's not because there's been less domestic violence going on. It's not because there's been less child abuse going on. To the contrary, if you were the victim of abuse, neglect, or abandonment, either as an adult or a child prior to COVID-19, you can only imagine that if you are now sheltering in place at home more hours than what you were before, all of the additional stressors coming down with unemployment and loss of homes and all of the challenges that we face as a country right now, those numbers have increased. The problem with the decreasing numbers is that these victims have minimized their contact with these mandatory reporters that would normally blow the whistle, raise the red flag, and say, "Are you okay? Tell me about that bruise." All of the school teachers that would normally come in contact with these children are there. So we are going to face an unprecedented mental health and substance abuse crisis. We were doing it already, but on the ends, as we rotate out of this pandemic, the needs for service is going to be through the roof. We have to be prepared to provide those services, to provide those counseling, and to get people on the right path. The most recent statistics show that 25%, 1 out of every 4 children, has seriously thought about suicide within the past 12 months. If that number alone doesn't scare the hell out of you, I don't know what will. That is unprecedented. It's never happened like that before. And it's something that I know that we need to come together. Again, thank you for your advocacy. Thank you for your time. Thank you for providing this opportunity for us to come together in a safe and secure environment to talk about these things, because this is just not affecting Florida or Michigan. It's across our country. And if we don't get our hands around this stuff, we will continue to have problems. My information, if there's anything that we can do, is in the chat box. Please call upon us. If there's any policies that we've put in place, if we can collaborate with, I know that there's some law enforcement that are on the line. If we put something together that is helpful, we're more than willing to share it. And then again, from a more traditional law enforcement perspective, we're doing all these things to change people's lives, but we're also holding the drug dealers accountable. In Seminole County, we've charged more drug dealers dealing in deadly doses of opioids, more times with first-degree murder than any other county in the state of Florida. Something that I'm extremely proud of. I spent most of our time, because of the audience here, talking about our treatment and our recovery and changing the face of this. But in addition to that, there's a whole nother world for law enforcement, is to make sure that law enforcement officers are equipped with Naloxone. They're using Narcan, but at the same time, those people who are preying on the vulnerable hold accountable to the full extent of the law. Thank you, and I appreciate you guys.
Wow. Sheriff, thank you so much. Thank you for the whole concept of making sick people well, the whole concept of making sure that we look at the kinds of challenges that our communities and our folks are going through and how you're addressing them. We're need a little bit pressed for time, but there are some questions, and we put your email address, if that's okay, in the chat box. Well, it's too late now, but so folks may directly reach out to you. But you're in trouble now, good buddy, because I have your cell phone and I have a speed dial. We are always looking for opportunities to say, how do we make things better? And your example for law enforcement is certainly standing out, and we want to make sure that we access that information and those resources. I'm excited to hear about your Hope and Healing Center, the ACT Center, Victoria's Voice. I also want to know how you funded it all, so we'll be talking. All right, thank you again so much. Wow. It's in the chat, folks were saying it's really exciting that we have someone from law enforcement to sort of step up and take the lead. And we're excited about the fact that every single one of our precincts in the city of Detroit has gone through the Narcan training and have saved lives, and throughout Wayne County. So again, there are more steps that we can take and more things that we can encourage our law enforcement to get engaged with.